Hello. We know that healthcare is a top priority for Albertans and our government. While most areas of government are seeing their budgets frozen or reduced, we're increasing our budget by $500 million. This reflects our intent to do things differently, to spend smarter, to achieve better health outcomes for Albertans, and to deliver better value to taxpayers. As your minister, I'm confident we can improve our health system while ensuring its sustainability. Our new budget is $17.1 billion. That's an increase of 3%. Over the past 10 years, health spending has grown by about 9% annually. We need to do what we do more efficiently so that the public healthcare system we rely on is there for our children and grandchildren in the future. Alberta Health Services will receive $10.5 billion in base operating funding for the delivery of health services across our province. This is a 3% increase, but it's lower than the 4.5% funding commitment we made to Alberta Health Services last year. But we believe Alberta Health Services can use its healthcare resources more effectively while improving Albertans' access to the health services they need. Currently, 20% of Albertans have no drug coverage of any kind. So to ensure comprehensive drug and supplementary health benefit coverage is available for all Albertans, a Pharma Care program will be introduced in 2014. All Albertans will benefit from lower generic drug prices as a result of government's decision to reduce additional generic drug prices effective May the 1st. You know, drug prices are among the highest cost drivers in our healthcare system. By containing these costs, Alberta will have the lowest generic drug prices in Canada. I'm very proud of the work physicians do for patients and the important role they play in delivering excellent health care across our province. Our doctors are the best paid in the country, but we must control the costs we can, especially in a time of reduced revenues, and better manage our physician budget to address high needs areas like family medicine, psychiatry, and geriatrics. Physician compensation accounts for over 20% of the healthcare budget and over 8% of the total government budget. We're spending $3.4 billion on physician compensation and development in this year's budget, an overall reduction of $73 million, or just 2.1%. This change reflects Alberta's fiscal reality and our desire to use healthcare resources fairly and effectively to ensure future sustainability of our healthcare system. Our budget is also about helping some of Alberta's most vulnerable people by focusing tax dollars on the areas of greatest need. For example, a new seniors property tax deferral program will allow seniors who own their own homes to defer paying taxes until they sell their home. A $262 million investment will help achieve our priority to improve access to primary health care. The investment will go toward primary care networks, family care clinics, and addiction and mental health services delivered in the community. These funds will help to ensure all Albertans have a home in the healthcare system. There are a number of exciting new programs this year. For one, diabetes care will be improved through a new insulin pump therapy program for Albertans with type 1 diabetes. Albertans who meet eligibility criteria will be provided 100% coverage for insulin pumps and basic supplies. And the health of young Albertans will be improved through an early childhood development investment of $8 million. To sum up, I believe we can use our healthcare resources more effectively while improving Albertans' access to health services. If you have any questions or concerns about this year's budget, I encourage you to connect with your MLA or to contact my office directly. Thank you for your time.